Hi there, this is Connie Welch with LifeBeyondHepatitisC.com. This is my post-treatment video update for week 3 that I have been off of treatment for hepatitis C. As of today, I have been off of treatment for 3 weeks and 1 day. I completed the triple therapy treatment September the 23rd, 2012 this year, and I'm very excited to be finished. And I wanted to give you a report of side effects, of what treatment, coming down off treatment has been like, and also the good things that have been going on in treatment recovery. But before I do that, I wanted to give you a quick recap of my treatment history. I am genotype 1, and hepatitis C has been living with me for 20 years, and I have been chronic active during that time. This is my 3rd treatment to do, and in 1995 I did treatment for the first time with interferon. At the time, that's all they had out at that time. I was a partial responder and then later did relapse. And in 2000 I did treatment again with the peg interferon and ribavirin that they had out. Due to some complications, though, during that treatment, I was not able to complete that course of therapy. So this year, on April the 9th, 2012, I began the new triple therapy treatment that was approved last year by the FDA with the new protease inhibitors that actually is formulated and works differently than the old treatment in that with the protease inhibitors in the combination with the peg interferon and ribavirin, this literally attacks the virus cells themselves and has a much higher rate of success for cure for the Hep C virus. And that has definitely proven to be the case with me, and very excited about that. I wanted to share with you that this probably was the most difficult treatment that I have done. It was very hard. It had a lot of challenges with it, but I will say that it was very worth it. I would not want to do it again, but if I had to, I would. Treatment time is a very short period in your life, a very temporary time compared to the rest of your life. So you have to look at this at more than what it is, because it's giving you a new, it's giving you more time to live your life and in a better quality of life. So it is definitely worth it. So I would just encourage any of you out there, if you are seeking information about treatment, or maybe if you're in treatment now, to hang in there, to press on and to persevere, because you can do this. Believe me, if I can do this, anybody can do this. So, and, you know, you need to give it a try. So I would encourage you. You know, my doctor told me this last week that I have a 92 to 99% chance this virus will never return. And that is phenomenal. When you think about that 20 years ago, I only had a 20% chance of the virus even going into remission. So, you know, it's tremendous the progress that has been made. And I will go back in 3 weeks to see my doctor for my next blood work and to get the next virus load count done. And we will see what the results of that are. He has told me that testing and checkups will continue for quite a while before they would give me an all clear, probably a year or longer. So they just want to keep up with your progress to see, you know, how your body is reacting and doing. So that's a very, very good thing. So you want to stay on top of it. I have received a non-detected virus load count for week 4, week 12, week 16, and the last virus load count at 24 weeks still shows that I am non-detected. So just extremely elated that, you know, I've come this far and I can wave the victory flag, and that my total treatment time was 24 weeks based upon my blood work results and the tolerance of the side effects. So it was difficult, and I don't want to scare anyone, but at the same time, you should know going into it that there's going to be a lot of good, bad, and ugly days, but there's good on the other side. So you just have to keep pressing forward. I wanted to share with you too that I mean, it's just such a wonderful, elated feeling to be through with treatment, and I cried many tears when it was over because I was just so relieved, so relieved. There were some times during the course of treatment that I wasn't sure if I was going to make it, but I just kept trying to put one foot forward and just concentrate on one day and to get through that and get to the end of the week and get to the next week where I could check off another mile marker week and get another week behind under my belt. So, it was tough, but it was good. I'm glad, and I'm glad now it's over. But you don't go through any battle without having scars and battle fatigue, and it takes time to recover. So, that's just part of the process. You have to be patient with that. But I wanted to share with you what some of the post-treatment side effects have been like in week 1 and week 2, and now as I'm beginning week 3. So I've had low-grade fever that's been intermittent throughout the weeks. I've had slight headache, muscle aches that have, been not severe, but been mild to medium, enough where I would have to take something to help relieve some of the discomfort and, sit in a hot tub and use a heating pad and things like that. But that hasn't been all the time. It's just kind of come and gone. So very glad about that. Had some trouble sleeping, mainly in week 1 and 2, but that is getting better now. Still low energy has been something that's been pretty constant. But I can see now that I'm in week 3, that's starting to pick up and get better. Experienced some periods of sinking feeling, but that would pass. I might have just a wave of nausea that was just very brief and just feeling very lightheaded, but then that passed, so it didn't stay very long at all. So overall, it's just been, I have felt like my body is trying to come off the drugs and to get it out of my system. I've tried to drink a lot of water and vitamins and, try to get a lot of rest, and that's been very helpful and made me feel better. So what about the good things that have happened? I wanted to share those with you. Number 1, the mouth sores that I was having in the thrush have cleared up, so that's no longer there. My taste buds are starting to come back. I was actually in the grocery store last week, and I felt like my taste buds just kind of came alive, and suddenly I was wanting everything in the store, and I could actually imagine, what some of those foods tasted like. So it was kind of like Christmas, because, I haven't had that for over 6 months. So it was very nice. I was driving down the road the other day, and the sun was shining down on my arms, and I just had to take a double take because I could actually see hair that was starting to grow back on my arms. So that was kind of something that was kind of neat to see. And I have noticed that I'm sleeping better, and then the skin sores that I had are healing. So, and it also seems that I'm not as pale as what I was when I was on treatment. So it's like I'm getting some skin color back, which is very good. I definitely feel better each day. It seems like my energy and stamina is getting a little better. I still have days where I need to take breaks and I need to lay down and take naps, but I kind of get recharged, and then I can go on and do some things. But I don't have high energy, but it's not extreme low energy. So it's definitely improved, and I can see that it's getting better all the time. My sore throat and dry cough are gone pretty much. And it seems like my concentration is even better. I can definitely tell that I'm having periods of more clearer thinking now. So I can definitely tell that the meds are leaving my system. And I know it's going to take a while to recover and go through a healing process. This doesn't happen overnight. And, you know, it's one step, one day at a time, just like climbing to the summit, to get to the top of the treatment journey. So it's going to be coming down as well. So just have to have perseverance and patience in that process. And I'm learning the importance of rest stops and how important that is, along the way. But I was really thinking the other day about this whole Hep C journey, and it's really made up of three phases, of three parts. And number one is the preparation phase, and that phase is you're doing testing and going to doctor's appointments. You're getting your meds set up. You're researching information about treatment and medication. You're asking a lot of questions. You're getting things all set up with perhaps paperwork and preparing as best you can mentally and emotionally and physically and spiritually. I mean, it just affects every part of your being. So, just trying to go through all you can for the decision process that needs to be made and to get yourself prepared. So that's really phase one. And then comes phase two, which is actual treatment. And that's where, you've armored up and you're ready for battle and you're going through the whole treatment process. And it doesn't matter if you're, doing treatment with a protease inhibitor along with the peg interferon and ribavirin, or if you're doing just treatment with ribavirin and interferon, you're still going through a tremendous treatment time. And it doesn't matter how long, how many weeks that your treatment is. Treatment is treatment, and you just have to keep focusing forward and be focusing most importantly on what you can do and not on what you can't do and stuff. That is the most important thing. But then there's the recovery phase, which is the phase that I'm in now, and that's coming down off the treatment mountain. And it's been very good to be able to get through to the top of the mountain, to the summit, and be able to wave the victory flag and know that we have conquered, the virus. So that is a very, very good feeling. But again, the recovery doesn't happen overnight, and just have to be able to take one step and one day at a time. The big thing to remember about post-treatment is that you don't instantly turn into the Energizer Bunny. So it just takes time for things to get back to normal. So sometimes that's hard for me because I tend to have a type A personality, and I want to get things done in a fairly timely manner. And so I guess my biggest downfall would be really myself, that I don't give myself the time that I need to fully, come down the mountain like I need to. So that's something that I'm working on. It's taken a while for treatment, for it to sink in that treatment is over. It seems like for at least a week I was looking for pink ribavirin pills, and I literally had to write myself a note and leave it in the kitchen that treatment is done. So that was a very, very good feeling to be able to do that. But now it really is sunk in that treatment is finished, and I'm not thinking, oh, I have missed a dose of medicine. So it's very good that been able to experience that. I will be continuing to post on my progress. I think I had said earlier that I go back to the doctor in 3 weeks and have more blood work, and so stay tuned for those results as well. If you would like to find out more about treatment, or you have questions or need information, you can go to my website, lifebeyondhepatitisc.com. There's more details on my treatment journey as well. Um, so I have just got a variety of things on the website of resource and support help, and even financial and health information that is there for patients who need that. If you'd like to contact me for prayer or help with questions or anything, you can contact me through the website. But in closing today, let me say that descending this mountain is just a joy, and this has been a year that I will never forget. It's been full of a lot of challenges, but Jesus Christ has been there to see me through every step of the way, and He continues to do so, as well as my family and friends, and all you Hep C warriors out there that have contacted me. I give all the glory to God and just praise Him for this great gift and blessing. And also, I give all of you my sincere thanks and prayers and love, and just thank you so much for all your comments and support and prayers for me. I just appreciate it more than I can say. Well, just stay tuned for my next video, and I'll be looking forward to talking to you soon, and hope you have a really great week. God bless. Bye-bye.